Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started.
Good afternoon. I'm Larry Lazzara. We're here at the Chiropractic Legal Injury Conference, and I'm joined today by trauma psychologist, Dr. Sonia Raciti. Doctor, thank you so much for being here.
Thank you so much for having me.
So you're part of the first ever multidisciplinary panel at one of these continuing education courses. So what's been your experience so far?
Oh, this has just been a wonderful experience so far. We have a great panel. We've got lots of experts, and everybody is asking just really intriguing questions as far as how to proceed with different cases. I think the audience is already thinking about different cases that they need to refer and what to do with folks.
Sure. And that's the whole purpose of these, is showing how all the different disciplines of medicine work together and collaborate for best patient outcomes. So speaking of best patient outcomes, you and I have worked hundreds of cases together over the years, and you get referred cases where there's signs of anxiety, depression, PTSD, which is very common after an auto accident. So if you were to talk to the general public right now about what they could expect in terms of feelings, emotions, following a motor vehicle accident.
Well, typically the first couple days, you're going to feel a trauma response. And so it's very normal after having an accident, the first time when you drive your car again, to just feel kind of taken aback and to feel anxious, to feel nervous, and to really have memories of that accident. Usually within the first couple days, that's going to fade. Maybe the first couple days, you're going to have some nightmares, you're going to kind of ruminate, you're going to have some different thoughts about it, but within a very short amount of time, your mind should slowly start to reset, and you should slowly start to feel more comfortable driving again and thinking less about the accident. Where I worry is when that doesn't happen. And so the patients I see a couple weeks later, they're still really struggling to drive. They're really fearful of just even being in the vehicle. If they're a passenger, they're really having a lot of overreactivity. They're doing the whole and of course, like, the driver is then freaked out as well, right?
Sure,
and
absolutely.
So most of the spouses are then, telling them, "Oh my gosh, you're going to make me, have an accident," right? Because you're overly reacting to it. But neurologically, it's just this humongous fear response that just comes up and out, and it's so quick you can't even do anything about it. Mm-hmm. Mentally, you continue to think about these what ifs. What if I had just not gone to the bathroom beforehand and I would have been a minute quicker through the intersection?
Sure.
Or what if I had actually stopped at Starbucks and I would have been 5 minutes later through the intersection? You try to figure out what you could have done different, even if it's not your fault at all. Even if somebody rear-ended you, you're thinking, I should have just stopped ahead, or I should have braked differently, even though I had nothing to do with you.
Sure.
And it's really your mind trying to figure out, what can I do to protect myself from this again? Of course, the reality is that sometimes you can't. Sometimes an accident is just an accident.
And that's when the referral comes to you. So somebody refers you a new case. Can you just tell us what that looks like, and what are some of the therapies that you provide at your clinic?
Sure. So we do an hour-long intake. I really kind of go over, what happened, all the symptoms, what the person was like prior to the accident, and what they are like now. We do some assessment modalities, really looking at trauma, anxiety, depression in particular. If they meet criteria for PTSD, then we typically do trauma treatment. One of the best modalities, it's called EMDR. We really take that event and we take those symptoms. Let's say the person was rear-ended and they looked in the mirror right before the accident. That image probably plays in their mind often. And so we really, in slow motion, take that image and we take that apart so that this way slowly the mind can really reprocess that memory and slowly unhook from it and slowly let it go, so that this way they can just drive and really enjoy the driving experience without that same fear response.
Sure. Oh, that's amazing. And I can tell you from all the cases you've worked on with my office, amazing patient outcomes. Everybody loves you. And it's really nice to see that you have a reliable specialist out there that can handle these types of situations. Tell me about the role of compassion in what you do.
Oh, compassion really is my whole job, right? People come to me and they have such anxiety, they have such a fear response, and they feel like they're going crazy because this is not their typical normal.
Mm-hmm.
And it's really up to me to let them know that, when we look at trauma, depending on study, about 20 to 28% of people will have trauma reactions and will actually meet criteria for PTSD.
Sure.
That doesn't mean that something evil, bad, traumatic did not happen the other 75, 80% of the time. It just means that we're really resilient most of the time.
Sure.
But about 20 to 25 to 28% of the time we're not. And that's okay. That's where I come into play, where I kind of normalize it and I let them know, we're going to get through this. We're going to make it right through this. And I'm going to really be there for your journey. Within a short amount of time, we're really saying goodbye to each other. So outside of a traumatic brain injury, usually with just PTSD, we're really doing 5 to 7 sessions. Children are even shorter. Children are out the door within 3 to 5 sessions. Even my nonverbal children and even my children that have autism. I do trauma treatment that is play therapy based, and kids are resilient. I mean, their brains
Sure.
are just so flexible.
That's amazing. One situation that is pretty common in the personal injury world, where people are resilient at first, but they're in chronic pain.
Yep.
And they're suffering month after month after month, sometimes year after year after year. And studies have shown that chronic pain can lead to depression. Tell us a little bit about your experience on that issue.
So those are very, very interlinked. And sometimes we can have PTSD from the accident. We can also have PTSD from medical, right?
Sure.
And then we can also have the trifecta of chronic severe pain, which is also resulting in not sleeping and increased depression.
Sure.
And so you have a really, really grumpy bear that is in chronic pain who also has trauma underneath all of this and has double trauma because really they're fearful of the medicine paired with fearful from the accident. And so then it's really figuring out which one do I need to really work on first. But yes, study after study shows that chronic pain and depression are interlinked. And so a huge piece of it is really working with the person in understanding that a huge component of pain is mental health.
Sure.
And so everything is triggered through the brain. If I can really have them understand that, if I can really teach them mindfulness, pain reduction, and techniques to use, and if they really apply those techniques, it won't disappear, but it will decrease significantly.
Sure.
And so, building that trust, really having that compassion, building that rapport with my patients and really having them trust me in it. And, some people already utilize these skills. Some people already do yoga or mindfulness or meditation, but
Sure.
most of my guys typically don't. And so then I'm telling them we need to do meditation, and they're looking at me like, Doc, I'm not doing this. I'm
That's
like,
so funny. I'm probably one of those guys. Like, yeah, you can't drag me to yoga. I can't even touch my toes. So, yeah.
you know what, though? When I do it in session with them and we do it together,
Mm-hmm.
and I ask them then, how is your body now feeling? And they're able to really recognize, wait, I just went from a 7 down to a 5. then
That's
they
amazing.
actually utilize that skill.
Absolutely amazing. All right. Last question. When would you like to see the chiropractors refer the cases to you?
So with little ones, with kiddos, pretty quickly. So if the kiddos is not sleeping, they're screaming, crying in the car, they're really fearful, get them to me quick. Kids are very resilient. Within a couple sessions, they do much better. Grown-ups, if after about 3 to 4 weeks, they're not really back to their normal or almost back to their normal, refer them to me. And I mean, most definitely they can be referred quicker, but usually within the first 2 weeks, we're really looking for them kind of slowly kind of getting back into their normal. If they're not, referral.
Sure. Well, I can say firsthand with all the cases we've had together, you do an amazing job. The personal injury world is very lucky to have you. My clients are very lucky to have you. And you offer an invaluable service to victims of auto accidents and other traumatic events. So I have to thank you so much for what you do at your clinic, and also sincerely thank you for joining the panel today and sharing your expertise. So thank you so much, and it's a pleasure having you.
Thank you so much for having me. I really appreciate this, and I'm looking forward to collaborating with lots of great docs here.
Excellent. Yes, I'm sure they are as well. So thank you.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this episode with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.